further explanation for why I'm saying something the way I do. You can always interrupt me with questions on my way through, anything like that, okay? One thing with the report findings is it's probably one of the easiest speeches you give to your patients because you get a cheat sheet for this one. Yeah. You don't usually get a cheat sheet for the patient orientation, although that one tends to be relatively simple after you've given it more than once or twice. And then most of the other stuff like the health talk and that kind of thing, you don't usually get a cheat sheet with that one. But for this one, you just read off the sheet. And that's really the easiest way to do it. And that's how you're not going to forget something. And that's how you're going to make sure you have all the information down. So make sure you actually do fill this out prior to the patient getting there, more than 5 minutes before they get there. So you have time to actually think about what's on there. All right, so, and also the x-rays on this one, these are not real patient x-rays, so it's not actually good quality film, so just pretend they are. All right, so, this one, it is nice to see you. Okay. So, first thing we're going to talk about is you were told us that you came in, you had a little bit of neck pain, a little bit of low back pain, is that right? Okay, good. And also, you told us that you smoke. Okay. And so we're going to talk a little bit about that later. Okay. In the exams that we did on you, a couple of things that we found is that when we did the physical exam, when I was like pushing on your head and moving you around and all that stuff, trying to make you feel pain, some of those were positive. Like when you had your head straight ahead and I pushed down on your head and it hurt, that was one thing that said that you might have a subluxation in your neck. So we were looking at that. And then also when I had you give yourself a hug and when I moved you and hold you back that way and it hurt in your low back, that was also an indication of that. Okay. As far as the spinal exam we did, where you moved your head up and down and all that kind of stuff and all that fun stuff, we found that you do have a little bit of decreased range of motion when you turn your head to the side and that side. And that can also be a result of a bone not being right where it's supposed to be. And for the x-rays, what we found was that this is the one we took of your neck. You can pretend that's a regular little view box screen. And what we found on this is, it's actually a pretty normal x-ray, but we'll pretend it's not. And we found that one of the bones in here is not quite where it's supposed to be, and so we're going to work on correcting that and putting it back where it's supposed to be. But other than that, for the second x-ray, your neck actually looks pretty good. Okay? And for the other image on here, which English wasn't taken here at Sherman because somebody left the pants on. But other than that, that's why the zipper and the buttons were there. They didn't put them in, our little shorts that are so wonderful. But anyway, what we found is we also did find some subluxations in your low back. And in this x-ray, what we're actually looking at is we're looking through your back. So your right is your right side, left is your left side. And you do always need to tell your patient where the x-ray is because most patients have never seen an x-ray before. They don't know what they're looking at. So you have to give them landmarks. You have to tell them we're looking through your back. This is right, this is left, all that kind of stuff. Yeah. And as far as that goes, it's just identification. All right, and that is what x-rays. At this time, we don't really have any need to refer you to anyone else. We're going to try some conservative chiropractic care for the next couple weeks and hopefully your symptoms will resolve. And if they don't, we might change what we're doing. And then if it still doesn't resolve after a little bit longer, a couple more weeks, then we might consider referring you to okay. As far as what you can do to help me with your health, okay, because you're responsible for your health as much as I am. Okay, I need you to at least cut down on your cigarettes, if not quit eventually, okay? Because that always causes lots of damage to the body. But I'm sure that is nothing new. I'm sure people have said that to you many times. So we're going to work on that. And also, I'm making this up, but in your case history, you had said that you don't get a whole lot of sleep at night, so we're going to recommend you try to get a little bit more sleep, at least 6 to 8 hours a night. Okay. As far as the subluxations that we found in your spine, we found one, of course, in the very first bone in your spine, the atlas. And we we'll work on correcting that. We also found other ones throughout the spine.
And that's sufficient to say is point out maybe one specifically and then go, if there's a lot, because you don't want to know this one and this one and this one, but.
Yeah, because honestly, your patient doesn't care.
Okay.
They don't know what T1 is, they don't know what L5 is. You just say, okay, you hurt right there, you have a subluxation right there. You know, that's pretty much what you have to do. You say, yes, and you have others in other places, and we're going to be fixing those as well. As far as any sort of modifications to the way I'll be adjusting you, according to the x-rays, your spine looks really good, and so I'm not going to have to modify anything that I'm doing for your specific condition. Although you do have patients, especially your older patients, that will have a lot of degeneration in their spine, so for them, you might want to say something like, well, I'll be using less force when I adjust you, or I'll be using a specific instrument if you're going to be using activator, or something like that. As far as explaining and demonstrating a chiropractic adjustment, usually when patients think of a chiropractic adjustment, they think of supine diversified. So you usually don't have to demonstrate that particular move, but what they're more unfamiliar with is side posture toggle or knee chest or something like that. So generally you're going to want to demonstrate, if we had a side posture table, you would demonstrate on the side posture table the actual adjustment, specifically how the drop sounds. So you're going to want to raise the drop and drop like that, because that's, for some reason, it freaks patients out sometimes when they're not used to hearing that. And
You do it while their head's on the table?
no, you're just demonstrating it for them. So you say, this is what it's going to sound like when I actually adjust you, and you make the piece drop. Or the lumbar piece, whatever table you're using. You definitely want to demonstrate the drop. As far as visit frequency, I'm going to have you come in 1 time a week for the next 4 weeks. Okay. And if we're doing that, while we're doing that, I'll be correcting your subluxations, and we're going to be letting the muscles and the ligaments are going to adapt to the bone being in the correct position again, because it's been out for so long now that they're used to holding that in that wrong position. So it's going to take a little bit of time for them to readjust themselves and get used to holding the bone where it's supposed to go. Okay? That's why I might be adjusting you in the same place more than once. Maybe. Also, because we're putting the bone back where it's supposed to go, it's going to be taking pressure off the nerves, and it's going to allow your brain and nervous system to communicate with the body better. Okay? At the end of that 4 weeks, we're going to do a review and update, where we'll do the physical exam again, the spinal exam again, and we'll revisit everything that we've gone over to see how things have changed from now to then. Okay? And I fully expect that if you follow the plan of care and you come in once a week, that you'll be doing much better at that time. Okay. The other thing that I have to let you know is that here at the health center, we do have a patient grievance policy. So if you have a problem with me, a problem with your case doctor, a problem with the front desk staff, a problem with anything in here, you can talk to the front desk, you can talk to your case doctor, you can even talk to the director of the health center, and we will get it handled quickly as quickly as possible. Okay? Do you have any questions for me? Okay, then you can sign here. All right? That is the end of the report of findings.
Is there a time frame to this?
No.
5.
Yeah,
Well, for this class.
6 to
there-
8.
The informed consent you do